Hello everyone, today I will be talking about the chemical hazard benzene. So let's start off with an overview of benzene. Benzene is a well-documented chemical hazard that has significant occupational and environmental health implications. It is a volatile, colorless liquid with a sweet odor and is naturally present in crude oils. Benzene has multiple uses. It's used in manufacturing plastics, synthetic fibers, resins, rubber, lubricants, dyes, detergents, pesticides, and drugs. Its sources of exposure could be from industrial processes like refineries, from environmental pollution, gasoline vapors, vehicle exhaust, and tobacco smoke. Now, this presentation is relevant because of the widespread use of benzene and its toxicity, making it a critical focus for occupational health studies. In this presentation, we will be talking about three main points: the health effects of benzene, the exposure limits of benzene, and the common routes of entry of benzene. So for the exposure limits of benzene, we will be looking at the values established by three organizations, which are the Occupational Safety and Health Administration, OSHA, the American Conference of Governmental Industrial Hygienists, ACGIH, and the National Institute of Occupational Safety and Health, NIOSH. Now moving on to our first point of discussion, the health effects of benzene. So the information here is from the toxicological profile in the National Library of Medicine and the chemical fact sheets provided by the Centers of Disease Control and Prevention. Now, there are two main types of effects that benzene causes. Firstly, the acute effects, and there are three ways to experience that. First, through inhalation. So when high concentrations of benzene is inhaled, it causes you to experience dizziness, drowsiness, confusion, tremors, and unconsciousness. The second way is skin or eye contact. So when your eye or skin comes in contact with benzene, you experience irritation, defatting of skin, which is when benzene dissolves or removes the natural lipids or oils that's present in the outermost layer of your skin. And a prolonged exposure in that manner can eventually lead to severe skin damages like scaling, dermatitis, or other secondary infections. Or you could experience mucous membrane irritation. That is when there's a stinging sensation in your eye, your nasal cavity, or you have a sore throat. And third, aspiration. That's to do with liquid benzene. So even if you take in a small amount of liquid benzene, you could end up having pulmonary edema. That is when your lungs build up with fluids, or you could hemorrhage, where your blood vessel clots. Now, the second type of effect is the chronic effects. There are two main types. Firstly, the hematological effect has to do with your blood. You could end up having bone marrow suppression. That is when your bone marrow becomes inactive. So eventually it leads to conditions like anemia or aplastic anemia. That is when your bone marrow fails to produce enough blood cells in your body. So you end up having a condition called pancytopenia, where there's a deficiency in red blood cells, white blood cells, and platelets. Now, the second type of chronic effects is the carcinogenic effect. That's to do with cancer. So you could have acute myeloid leukemia. And that is when your bone marrow produces a lot of abnormal white blood cells, which then surrounds the normal white blood cells, leading to severe symptoms. So you could end up having cancer or other forms of leukemia or lymphomas. Now, keep in mind that the International Agency of Research on Cancers and the National Immunization Program have categorized benzene as a known human carcinogen, meaning that there's enough evidence to support the fact that benzene can cause cancer in humans. Now, moving on to our second point, exposure limits. Now, we said that we will be looking at three organizations. So the first exposure limit, the threshold limit values, we'll be looking at the value established by ACGIH. And they state the TLV to be 0.02 part per million over an 8-hour time-weighted average. So this value was revised in 2024. So previously it was known to be 0.5 part per million. So as you can see, there's a substantial reduction. So this reflects updated evidence on benzene's carcinogenicity or benzene's potential to cause cancer, and bone marrow toxicity. Now, the second exposure limit is the permissible exposure limit. So we will be looking at the PLV established by OSHA, and they state it to be 1 part per million over an 8-hour time weighted average, and 5 part per million for 15-minute short-term exposure limit. So this value was reduced from 10 part per million in 1987. Now, the third exposure limit is the recommended exposure limit. So we'll be looking at the value established by NIOSH. So NIOSH states REL to be 0.1 part per million for a time-weighted average and 1 part per million for a short-term exposure limit. So this designates a potential occupational carcinogen as per OSHA policy. Now, moving on to our final point, common routes of entry. So the information here is from the OSHA Appendix C. There are 3 main common routes of benzene entry. Firstly, it's through inhalation. Inhalation is known as the primary route and is dominant in occupational settings like refineries or chemical plants, and environmental exposure like vehicle exhaust or tobacco smoke. Now, inhalation is known as the primary route and is dominant in multiple settings because of benzene's high volatility, which leads to rapid inhalation exposure. Now, the second common route of entry is dermal absorption. Dermal absorption occurs with liquid benzene contact. Now, its effects is enhanced with abraded or scraped skin or mixtures with other solvents. Its effects can contribute to systemic toxicity and skin irritation. Now, the third common route of entry is oral ingestion. Now, oral ingestion is less common, but it may occur via contaminated food or water, and it may possibly impact the systemic absorption, but its impacts are minimal to inhalation. So to summarize everything, I will talk about the dose-response relationship of benzene. So a dose-response relationship describes how the severity of health effects increases with exposure levels and duration. So for benzene specifically, we have low-level long-term exposure. Now, this is associated with chronic effects like leukemia and blood disorders. So according to the National Library of Medicine, studies shows increased leukemia risk for exposures as low as 0.1 to 1 part per million over years. And secondly, there's high-level short-term exposure. This causes acute effects like central nervous system depression and pulmonary damage. Now, according to NIOSH, exposure to 3,000 parts of benzene per million parts of air from 0.5 to 1 hour is endurable, but it's toxic. So in summary, the dose-response relationship of benzene shows how exposure levels impact health. So make safety a habit, use the appropriate PPE, ensure proper ventilation, and always report potential hazards immediately. Thank you.